everyone, this is Marika and welcome back to another session with me. As we are dealing with the sixth unit, till today we have completed various different methods of teaching like lecture, demonstration, role play, panel discussion, seminar, symposium and many more, right? Today we are going to start with clinical method of teaching or clinical teaching method. So as we are in nursing profession, clinical teaching method is one of the major aspect for our profession, right? Now, clinical teaching methods, as the term suggests, is a method, are those methods which are used to teach clinical skills to the students, right? In this session today, we are going to see what are clinical teaching method, what are the various purposes, and what are the different clinical teaching methods that can be used especially in nursing profession. As nurses, we need learning or we need to learn majorly three domains in our profession. The first one is cognitive, that deals with our intelligence, right? The second one is affective, which deals with the feelings, emotions, and values. And the last one is psychomotor. Now in nursing, three different domains are to be learned, or three different domains plays an important role, which is cognitive, affective, and psychomotor. Psychomotor domain in nursing includes those skills that are required as a nurse to practice in a clinical area, right? Out of all three aspects or out of all three domains, psychomotor is the most important and most essential domain that as a nurse or as a nursing student we must have. Now, why do we need psychomotor skills as nurses, right? In order to provide effective and quality care to the patient, we need to have proper psychomotor skills, right? So psychomotor domain includes every skill that a nurse has to perform to render a holistic care to the client, right? So nursing is all about providing holistic care to the patient. So in order to we provide quality care to all the patient, we need to develop psychomotor skills. Therefore, it is necessary for all the nursing students and all the future nurses to learn clinical skills or to have proper clinical learning so that they can provide a proper and a quality care to the patient. Now, this clinical learning or clinical teaching to the nursing students must be carried out through the most advanced and effective ways, right? So clinical teaching can have different ways and different methods, right? But to provide the best learning experience for the nursing students, the nurse educator or the teacher has to select the most effective method as well as the method that is the most advanced, so that the knowledge of the students is up to date according to the technology and advancement in the technology. All right. According to Skewer, clinical teaching method, right? Clinical practice is a vehicle that provides the students with the opportunity of correlating whatever theoretical knowledge that they have gained with the practical situation. So in nursing, when we think about our theoretical classes as well, we are taught about the procedures, we are taught about the care that we have to provide for the patient, what is the effective way of providing care to the patient, how to actually plan effective nursing care for the patient, right? But it is all in theory. Now, all those basic theoretical knowledge has to be converted into psychomotor skills to provide that care to the patient, right? So according to Skewer, he says that clinical practice or clinical learning is one of the method, or it cut or calls it as a vehicle which helps the nursing students, which provides the nursing students with an opportunity of translating or converting what they have learned basically as a theory into various psychomotor skills. A clinical teaching method can also be considered as a partnership between the clinical instructor, the educator, and the student within a shared environment where the teacher's primary aim is to make sure that the teacher affects the behavior of the students towards the intended purpose. And clinical teaching is a time-bound process. So this definition of clinical teaching says that it is a time-bound process, right? So clinical teaching is is carried out for a limited period of time. So it is a time-bound process where the teacher and the student will share a partnership. They will have a partnership with one another in a shared environment where the teacher actually has an aim, the teacher has an objective, and the teacher's objective is to make sure that the students develop those attitude and behavior towards the goal. Okay, so in clinical teaching, obviously the goal of the teacher is to make sure that the students are able to develop the behavior, attitude and skills that are required for them to provide holistic care to the patient. The teacher acts as a guide and a mentor and help the students to develop those psychomotor skills so that they can become competent in providing proper care to the client. All right. So here in the picture, you can see how a clinical teaching practice is carried out, right? There is a nurse educator who educates her students on various different aspects that is required for the students to know in a clinical area. All right. Now, what is the role of the teacher in a clinical teaching practice or in a clinical learning method, right? The main activity of the teacher, as I said in the introduction, is to guide and to act as a mentor for the students. So the clinical instructor is there present in the clinical area with the students so that the teacher or the instructor is able to guide the students to develop the skills that they need to become an efficient nurse, right? As a clinical instructor or as a teacher in the clinical area, the teacher must be able to guide and stimulate and facilitate learning for her students, right? So it is the teacher who helps the student to understand the patient. It is the teacher who helps the student to understand the condition, to clear if they have any kind of doubts, right? So the teacher not only guides the student, but she should also be the one who stimulates the students to learn and also facilitate effective learning. Now, how can a teacher facilitate learning for her students, or how a clinical instructor can facilitate learning for her students is that now the teacher will have a thorough knowledge since the teacher has completed her course, she has undergone a training and then become a teacher, right? Now she has a proper idea about the clinical areas and the activities that are carried out in a particular clinical area. So the teacher should design appropriate activities that are carried out in an appropriate setting and help the student learn about those activities so that the teacher can facilitate proper and effective learning. By designing appropriate activities in proper area, by selecting proper areas and by designing activities that the students must go through or the students must carry out in a clinical area, the teacher is letting the students experience the entire process, what it is to be a nurse or what can a nurse do in such an environment. When the students undergo such kind of experience, it will obviously facilitate understanding and learning better, right? So as a teacher, the teacher not only guides and supports the students, but she also facilitates learning by designing appropriate activities that are to be carried out by the students in a clinical area. Let us now see what are the major responsibilities of a clinical instructor or a clinical teacher in the clinical area. The first one is to plan and implement clinical learning experiences through the most effective ways of learning. So as a clinical instructor, the teacher has to plan and not just plan the activities, not just plan the clinical learning experiences, but the teacher has to implement those plans appropriately in order to facilitate proper learning among the group of students. Okay, so planning and implementing the clinical learning experiences for the student is one of the major role of a clinical instructor in the clinical area. The second responsibility of the clinical instructor is to plan and prepare the clinical areas and also the resources that are required for the students to have a better clinical experience. So the teacher has to plan and she also has to prepare the clinical area where the students are posted, right? She has to make sure that the people in those particular wards, in those particular clinical area are aware that this particular students, this group of students are coming for clinical posting. They will be working there for a certain period of time where they have to achieve certain objectives, right? So the teacher has to make sure that she not only plans but also inform the people in the ward or in the clinical area about her students being posted in the particular ward for a certain period of time. Next one is to orient the new students to the clinical area. So as I said, when the students are going to a particular hospital, to a particular clinical area for the first time, the students might not know about the hospital, the areas of the hospital, right? So the teacher has to orient the group of students to the new clinical area so that there's no confusion within the students. They know where the particular ward is. The student, while working in a clinical area, might have to go from one department to another department, might have to go to laboratories, might have to go to blood bank and also to the pharmacy, right? So the teacher has to orient the students to the clinical areas where they are being posted. The students at least should have a basic idea about the wards that are available in the hospital, the pharmacy, blood bank, radiology department, and also operation theater and various other areas in the clinical setup. Alright, so it is the role of the teacher to orient the students to the clinical area. The next one is the teacher also facilitates or does the arrangement for all the required material and resources. Okay, so as the clinical instructor, the instructor must make sure that all the resources that are required for the students to carry out clinical posting in an effective way is all arranged before the postings of the students actually starts. All right. Another major role of a clinical instructor is to demonstrate clinical skills to her students, right? When the students are exposed to a real life situation, when they are the beginners, the students might not have the confidence to carry out the procedure. They might have learned it in theoretical classes, in the college laboratories, but they might not have the confidence to carry out the procedure in actual real patient, right? So for that, as a teacher, the clinical instructor has to demonstrate clinical nursing skills for the students so that they can see, observe and learn. Okay. So once a student have observed the entire procedure, what the teacher has carried out on real patient for the students, she can ask for the written demonstration from the students so that the students are motivated and their confidence level is increased. So written demonstration obviously helps the teacher also to know whether the students have actually acquired knowledge and skills or not, right? So in order to have a proper idea whether the students have become efficient or not, whether the students have learned the skills or not, the teacher can ask the student to perform a written demonstration. All right. The next role of the clinical instructor is to make sure that she helps the students to slowly become independent in learning those clinical skills. Now, as we have discussed in the previous one, the teacher teaches the student, the teacher actually demonstrates the clinical nursing skills required, and the teacher asks for a written demonstration, right? Now, the teacher slowly has to make sure that the student doesn't require her to perform clinical nursing skills or to demonstrate clinical nursing skills. Rather, they become independent in performing all the learned skills. So it is a gradual process. It is a slow process, right? It requires time for the student to get adjusted to the environment, learn and perform those procedures on the real patient. So even though it is a slow process, the teacher has to be there as a guide and must help the students to slowly become independent in performing the learned skills or the learned activities. All right. Next one is the teacher has to make sure that the students have gained competency in those skills. So first the teacher is demonstrating it for the students and asking for written demonstration, right? We cannot expect that the students will be able to do it at once. It is a gradual process. As I said, it takes time to learn. It takes time to build up the confidence among the students, right? So the students slowly will learn how to do it. And finally, the teacher helps the student to also gain competency over the skills that they have learned. And the final role and the last role of the clinical instructor is to keep herself updated. keep herself updated with the most effective and most advanced ways of clinical practice. So as a teacher, if I am the clinical instructor, if I am taking a group of students for clinical skills, right, for hospital postings, then as a teacher, I must be competent. I must know the most effective ways of dealing with patients' problem, the most advanced method of dealing with the problem of the patient, right? So the clinical teacher or the clinical instructor has to keep her knowledge up to date. She has to keep herself updated, all right? So till now, I hope you've understood what a clinical teaching method is and what is the role of the teacher or clinical instructor in clinical teaching method. Now, let us discuss the qualities the teacher must have as a clinical instructor. The first one is available, non-threatening and approachable. So as a clinical instructor, the teacher must be approachable, right? Because the clinical areas gives the students with various different kinds of opportunities, right? The students are exposed to totally different environment every now and then, right? The teacher must be approachable and available for the students so that the students can go to her and ask about her doubts, ask about their doubts and share their problem in the clinical area, right? The teacher is the experienced one here. The students are not, right? They are exposed to the environment for the first time, right? So what happens? The students might not be able to deal with the problems that they face. So as a teacher in a clinical area, the teacher must be approachable. She must always be available for her students and must be non-threatening. All right. Next one, the teacher has to be resourceful. Of course, as a clinical instructor, the teacher must be resourceful in order to teach her students clinical learning. All right. Next one is non-judgmental. So as I said, clinical practice, to practice those skills on real patient is a long-term process. It is a gradual process, right? The students do not gain competency at once. They need time to learn those processes. They might make mistakes. So as a clinical instructor, the teacher, the instructor must be non-judgmental. Next one, the teacher should be clinically competent. Of course, as we have discussed the role of a clinical teacher, we know that as a clinical teacher, the teacher has to be clinically competent. If I want to teach you about a certain topic, I must have a thorough knowledge about the topic, right? Similarly, like that in practical situation also, if the teacher is there to teach the students, if the teacher is there in the clinical area with the students, the teacher must be clinically competent in order to make sure that the students gain proper learning experience from the clinical area. Enthusiastic and passionate about clinical teaching. So as a teacher, as a clinical instructor, I must have that enthusiasm and I must be passionate about teaching clinical experience or teaching clinical learning to my students. The next one is empathetic. So as a nurse, whether we work in a clinical area, whether we work as a clinical instructor or as a teacher, in nursing profession, it requires the nurse or the nursing professionals to be empathetic. So as a clinical instructor also, we must be empathetic towards the students, towards the patient. Let us see the major qualities required in a clinical instructor. The first one is attitude, knowledge, and clinical skills. So as we have been discussing, the teacher is there to teach the clinical experience. The teacher is there to teach the clinical skills to the students. She must have the proper attitude. She must have proper theoretical knowledge as well as clinical skills so that she can be called as a competent teacher. Right? The next one is, of course, availability and affability. The teacher must be affable and the teacher must be available for her students. So these are the major three qualities that is required in a clinical instructor. Okay, so let us now see what are the different types of clinical learning method in a clinical area. So there are various types of clinical learning methods that are used in clinical area. The first one is nursing case study. So this is a very familiar term, right? We all write case study during our student period. What is a clinical nursing study? So a nursing case study is an in-depth study and analysis of the patient. Okay? A patient with a specific illness who is receiving nursing care ranging from 7 to 10 days. So a clinical nursing study is a study on the patient who has a specific disease and who has received the nursing care from around 7 to 10 days. Okay. So all these different methods of clinical learning or clinical teaching, we will learn in detail about all these different methods. Today, I'm just going to briefly explain what these methods are. All right. Next one, we have nursing case presentation. So nursing case presentation, it refers to a presentation of a particular case or a particular patient in detail, including from the name of the patient, address, clinical diagnosis of the patient, the symptoms of the patient, the treatment that the patient is undergoing, the medical and surgical procedure that has been carried out for the patient, and the best possible nursing care. All right. Next one, we have nursing rounds. Now, in nursing rounds, a group of students are selected for a particular patient, right? A group of students are assigned with a particular patient where they go to the bedside of the patient and discuss in detail about the progress in the patient's health. And they also plan about future or further nursing care for that particular client. Next one, we have bedside nursing clinic. So here also a small group of nursing students are selected and they are assigned with a particular patient. The clinical instructor goes to the bedside of the patient and teaches the students about the particular disease condition on the real patient. All right. It is also called as bedside teaching. Next, we have nursing assignments. It refers to assignment of a particular task, nursing task or a particular patient to the nursing students under the direct supervision of the nursing instructor or the clinical instructor, where the students get to learn about the nursing task that they have to carry or about the patient that they are assigned with. All right. Next one, we have nursing case conferences. So nursing case conferences refers to two or more nursing professionals who come together in a formal discussion and discusses about a particular problem or a particular patient and tries to find the solution to the selected problem. Or the discussion is also conducted in order to provide the solution to the health problems of the patient. Next, we have health team conferences. So similar to nursing case conferences, health team conferences involves not only nursing professionals but healthcare members from different departments who come together in order to find a solution to a particular problem or in order to discuss a particular problem. All right. Next, we have process recording. So it is a process in which the students are given the opportunity to directly interact with the real patient under the supervision of the clinical instructor. Here, the students will gain communication skills. They will also get to record the entire communication that they have with the patient. They get to develop critical thinking and also history taking from the patient. And the last one we have is field visit. So we've already discussed about field trip or field visit, right? It is a process in which the students are taken out of the classroom where they are actually allowed or where they get the opportunity to actually visualize the process. They actually get to see a place or observe a certain phenomenon. Right? So these are the various methods of clinical teaching and learning. So this is just a brief introduction about each of the method. In our next session, we will deal with each of this method one by one. All right? Now let us see the guidelines for selecting method. As I said, there are several methods in clinical teaching. Now, how a clinical instructor must select the best method for the students? What are the guidelines that are to be looked after before selecting the best clinical method for the students? The first one is it must be concurrent with the educational objective and the desired changes in the behavior. We must see as a clinical instructor or as a clinical teacher from all the different methods of teaching which is actually concurrent with our educational objective and which is the best suitable method to actually achieve the desired changes in the behavior of the students. All right. Next one, we must also see and We must also see and keep in mind the principles of various teaching learning method. So we have to keep in mind the principles of teaching and learning before selecting before selecting a method as a method of teaching for our students. Next one, we must also see So according to the capabilities and capacities of the student, we must select the best method that is suitable for the particular group of students. Next one is according to the availability of the resources. We must also see the availability of the resources within the clinical area, but within the educational institution before we choose a particular method of teaching. And the last guideline is to also see the teacher's ability to actually use the method of teaching effectively and efficiently. So there are various methods of clinical teaching, right? The teacher might choose a particular method, but the teacher may not be able to use that method effectively. So teacher must see that the method that she chooses is the best one for her to deliver her lecture or her particular clinical skill. According to the teacher's ability to use that method that she has selected for the best learning outcomes for her students, the teacher can select the clinical method of learning. All right. So these are the various guidelines that the teacher must look after in order to select a particular method of teaching. To summarize, today in this session, we have discussed about what is a clinical teaching method, what are the different clinical teaching method, what is the role of the teacher in a clinical method, what are the different qualities of a teacher or a clinical instructor, and finally, what are the guidelines that are to be followed as a clinical instructor or as a teacher to select the appropriate method of teaching in a clinical area, right? I hope the class was helpful, and I'll see you all in the next session where we will discuss the different types of clinical method in detail one by one. Thank you and have a great day ahead.